10 of Drug Talk. Today we're going to be discussing a medication used for sleep known as Zopiclone, or the brand name Imovane. This medication has a similar pharmacological profile as the medication that we discussed in episode 8, which was lorazepam. If you watched that episode, at one point during it, I discussed that lorazepam binds to the GABA-A receptors. Zopiclone, or Imovane, binds to these same receptors. Its properties are a hypnotic, or sedative, anxiolytic, or anti-anxiety, anticonvulsant, as well as muscle relaxant. I found this interesting while doing my research for the episode because prior to my research today, I thought that it only had sedative or hypnotic properties. Even with these pharmacological properties, however, it's only marketed and really used for sleep. It's important to note that sleep disturbances could be the manifestation of a physical or psychiatric illness. For this reason, the decision to initiate therapy with this medication should only be made after a patient has been carefully evaluated by their physician. In terms of precautions, it's important to note that sedative hypnotic medications like Zopiclone or Imovane have a risk of developing dependence in individuals. The risk of dependence or abuse increases as the dose increases or the duration of treatment increases. Another precaution is the use of alcohol while using this medication. See, alcohol and Zopiclone are both CNS depressants. So for this reason, if you use them both together, you would have an increased effect and an increase in that CNS depression. Contraindications to this medication, or reasons a physician would not be able to prescribe it to you, would be if somebody had myasthenia gravis, which is a condition characterized by muscle weakness or atrophy, they wouldn't be able to use the medication. It's also contraindicated in individuals who have severe hepatic or liver dysfunction. And finally, individuals who have severe impairment of their respiratory function should not use this medication. An example of this would be significant sleep apnea syndrome. In terms of dosing with Zopiclone, it's available as a 5 mg as well as a 7.5 mg tablet. Treatment usually should not exceed 7 to 10 days in acute situations. Treatment for more than 2 or 3 weeks usually require reevaluation by your physician. Since dependence can develop with this medication, it's a good idea to use the lowest effective dose possible, which gives you the sleep you require. This medication seems to work really well in people who have trouble falling asleep, have frequent nocturnal awakenings, or have early morning awakenings. Side effects that you could notice after using this medication are a bitter taste in your mouth. Some people describe this even as a metallic taste in your mouth. This would not be a reason to stop the medication or be concerned unless it was very troubling to you. Some people experience dry mouth or bad breath, as well as upset stomach and sometimes diarrhea. Some people, due to the sedative effect, experience somnolence or sleepiness, and dizziness and confusion can happen in individuals as well. Cases of amnesia have happened in individuals using benzodiazepines and benzodiazepine-like substances, like this medication. And finally, behavioral changes or abnormal thinking have happened rarely with this medication. The last thing I'd like to mention is that individuals above the age of 65 should start off with a lower dose than 5 mg. Sometimes they split the 7.5 mg to total 3.75 mg and start individuals of a higher age on a dose like this. This reduces the risk of falls in individuals of a higher age. Alright, so that's all we're going to talk about today with Zopiclone. As always, I appreciate everybody for stopping by and watching my videos, and if you'd like to see the channel grow, just hit that like button or subscribe to the YouTube channel. Alright, so we'll see you guys tomorrow. Take care.